the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Hip fracture recovery tips for caregivers. Caring for a loved one during hip fracture recovery can feel overwhelming, but with the right knowledge and preparation, caregivers can make a significant difference in their recipient of care's healing journey. Hip fractures affect approximately 350,000 Americans annually, with the majority being older adults whose recovery requires comprehensive support at home. Research has shown that patients who recover at home achieve better outcomes than those in skilled nursing facilities, making a caregiver's role absolutely crucial. Whether you're a family member or a trained personal care assistant, understanding the recovery process and implementing effective care strategies will help ensure the best possible outcomes for your loved one. Let's learn about what you can do to help. Understanding hip fracture surgery recovery time. Hip fracture surgery recovery time varies based on the type of procedure and individual patient factors such as age and other health conditions. While bones typically heal within 6 to 8 weeks, complete hip fracture surgery recovery can take 3 to 6 months, with some patients requiring up to a year to reach their maximum recovery potential. It's important to understand that approximately half of hip fracture patients may never fully regain their pre-injury mobility level, making realistic goal setting essential for both caregivers and patients. The initial recovery phase focuses on allowing surgical sites to heal while preventing complications. During the first few weeks, patients typically use walking aids like walkers, crutches, or canes, gradually progressing to more independent mobility as healing advances. Creating a safe recovery environment. Preparing the home environment is fundamental to successful hip fracture rehabilitation. Here's a quick checklist of items to create a safer recovery environment. Remove all tripping hazards, including area rugs, loose mats, and electrical cords from walkways. Arrange furniture to create wide pathways that accommodate walkers or crutches, ensuring your loved one can move safely throughout their living space. Install grab bars near the toilet and shower in the bathroom. Consider adding an elevated toilet seat to reduce strain on the hip. A shower chair can make bathing safer and more comfortable during the early stages of recovery. Temporarily convert a first floor area into a sleeping space to eliminate the need to navigate stairs for patients with upstairs bedrooms. Position frequently used items at waist height or higher to prevent the need to bend over during recovery. Set up a comfortable sitting area with a high, firm chair that has arms for easier transfers, allowing feet to rest flat on the floor. Supporting physical therapy and movement. Hip fracture rehabilitation begins immediately after surgery, and caregivers play a vital role in supporting this process. For most patients, physical therapy initially emphasizes keeping weight off the hip while prompting circulation and preventing complications like blood clots. Early exercises often include simple chair-based movements, progressing to standing activities, and eventually walking. Encourage your loved one to avoid sitting for more than 45 minutes at a time, as prolonged sitting increases blood clot risk. Help them perform prescribed home exercises between therapy sessions, as consistent movement with weight on and off the bone stimulates healing most effectively. Support the progression through mobility milestones, celebrating achievements like transitioning from a walker to a cane or successfully climbing stairs. Remember that recovery occurs in stages, and each small improvement represents significant progress. Managing medication and nutrition. Proper medication management is crucial for successful recovery. Create a written schedule for all medications, including pain relievers and blood thinners, checking off doses to prevent missed or duplicated medications. Taking pain medication as prescribed is essential, as uncontrolled pain interferes with exercise and mobility. Focus on nutrition that supports healing, emphasizing foods rich in protein, calcium, and vitamin D. Protein helps maintain and build muscle strength, while calcium and vitamin D are essential for bone tissue growth. Some medications may reduce appetite, so gentle encouragement and appealing meal presentation can help ensure adequate nutrition. Meal replacement drinks may also be an option. Addressing emotional and psychological needs. Many patients develop a fear of falling after their injury, which can significantly impact their willingness to participate in rehabilitation. As a caregiver, acknowledge these fears while gently encouraging movement and independence. Provide emotional support and reassurance, understanding that anxiety about re-injury is normal and valid. Be patient with the recovery process, as healing takes time and progress may seem slow. Maintain open communication with healthcare providers about any concerns or changes in your loved one's conditions. Supporting your family's recovery season. At Best Care, we understand the complexities of supporting loved ones through hip fracture recovery and are here to help with all of your questions related to family caregiving. We're committed to providing the guidance and resources you need to ensure the best possible outcomes for your family's unique situation. Contact Best Care to learn how we can help on your caregiving journey. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.